Good morning, and thank you for joining us to mark the 3rd Annual Canadian Viral Hepatitis Elimination Day. My name is Jennifer Van Gennip, and I'm the Executive Director of Action Hepatitis Canada. We're a coalition of 83 community-based organizations holding the government accountable to the commitment Canada made to the World Health Organization to eliminate hepatitis B and C as public health threats by 2030. We come to this work as health equity advocates to ensure that as we work toward elimination targets, we are not leaving behind people who face barriers due to geography, race, poverty, or stigma. 8 people die each day here in Canada from viral hepatitis. This is completely unnecessary, given that hepatitis C is curable and hepatitis B is preventable with a vaccine that we've had for decades and can be managed with effective treatments. The world has the tools to make viral hepatitis elimination possible. Now we need the policies to get us there. While healthcare is delivered by the provinces and territories, we have identified 5 ways for the federal government to accelerate our progress now. The first is a plan. An updated federal action plan for sexually transmitted and bloodborne infections, or STBBIs, was launched in January of this year. Unfortunately, the plan does not include any targets to measure Canada's progress or to inform federally funded projects. Targets are integral to an elimination plan. So we are asking the government to add targets to the 2024 to 2030 STBBI action plan. I'll now turn the podium over to my colleagues to share the other 4 asks, starting with Jennifer Nebesky, President and CEO of the Canadian Liver Foundation.
Thanks, Jen. Hi, everyone. As Jen mentioned, my name is also Jennifer, and I am here on behalf of the Canadian Liver Foundation to address an urgent public health issue that affects many Canadians, particularly our immigrant and newcomer populations. Today, we face the significant shortcomings in our hepatitis screening processes. Our current hepatitis screening guidelines target narrowly on specific risks, a strategy that too often fails to detect the virus early enough to prevent liver complications or death. Moreover, the absence of consistent national screening guidelines for hepatitis B results in diagnoses that are frequently found too late and at the end stage of liver cancer. This failure in our screening processes disproportionately affects our immigrant and newcomer populations, who account for up to 70% of hepatitis B and 30% of hepatitis C cases. These individuals often encounter barriers that delay diagnoses and access to care, exacerbating health disparities and burdening our healthcare system. The Canadian Liver Foundation advocates for a significant shift in our screening practices from risk-based to an evidence-based approach to hepatitis C and establishing robust national guidelines for hepatitis B. Additionally, we urge the immediate implementation of universal, voluntary, free hepatitis screening for all immigrants and newcomers on their arrival to Canada. This cost-effective approach, aligned with global best practices, is essential to reducing the stigma, ensuring early and effective linkage to care, and ultimately eliminating hepatitis virus as a public health threat by 2030. And screening is only the first step. I would like to pass the floor to my colleague, Dr. Jordan Feld, who will discuss the pivotal role of technological innovations to ensure our elimination of viral hepatitis. Thank you.
Thank you, Jennifer. We've heard that the goal is to try to eliminate viral hepatitis by the year 2030. To do that, the first step in treating and curing people of their infections is to diagnose them. We can't treat people that haven't yet been diagnosed. And we know this is a problem. This problem has led to the fact that at least 30% and maybe upwards of 50% of people living with hepatitis C and hepatitis B in Canada don't know about their infection. This is really a problem. To fix this problem, we need better diagnostics. We need better tools to make the diagnosis for these infections simple. We know it can be done. There are very simple tools to make these diagnoses, but we don't have these available in Canada, and we don't have a strategy to develop them. Now, we know we can do this. We all just lived through a horrible pandemic, but one of the remarkable things about our response to COVID-19 was our ability to develop very quick, very rapid, and very effective tests within months of recognizing this global this virus that caused a global pandemic, we had new tests that not only were accurate, but allowed us to do self-testing, allowed us to do rapid testing, and allowed people to get the care they needed. For hepatitis C, people have to go to the doctor, get a test, then go back to the doctor to get a result, go back to the lab to get another test, and only then do they finally find out that they've got this infection that can be cured. We would like to move this paradigm so that they get a simple test, a finger prick of blood, a test result within half an hour or less, and they can move on to get cured. And similarly, we could do the same for hepatitis B. If we can try to enable these policies to encourage manufacturers of testing modalities to make sure that they actually have an incentive and a pathway to get these tests developed and approved, just like we did for COVID, we can make great strides in our goals to try to eliminate viral hepatitis. The first step is diagnosis, and right now we're not doing that well. We could do much better. And now I'm going to pass on to my colleague, Dr. Carla Coffin, who is a hepatologist based in Calgary and the president of the Canadian Association for the Study of the Liver.
Thank you, Jordan. Good morning and good afternoon to those of you in Newfoundland. So I'm here to talk to you about the importance of infant or birth dose hepatitis B virus vaccine. In fact, I would like to quote Max from the Action Hepatitis Canada report, who said that if I had received the hepatitis B vaccine, I would not be talking to you today living with chronic hepatitis B infection. The World Health Organization has recommended that every child should receive the hepatitis B vaccine within the first 24 hours after birth. At minimum, they should receive it before their two-month infant vaccination series. Despite these recommendations, in Canada, we still have 5 provinces that delay vaccination until school age or pre-adolescence, including our largest province with over 14 million people, the province of Ontario. That is essential in order to achieve hepatitis B elimination, is to implement infant or birth dose hepatitis B vaccination. Thank you. I'd like to introduce my colleague who is a senior scientist at the Ottawa General Hospital, the Ottawa Research Institute, to talk to you about the importance of data to inform hepatitis B and hepatitis C elimination.
Good morning. My name is Angela Crawley, and I'd like to speak to the last of our 5 federal asks, the need for data on the prevalence of viral hepatitis. Never has the currency of data been so valuable in science as it is today. But how can we track our progress in eliminating hepatitis B and C without good data? At this time, we cannot reliably estimate the prevalence of hepatitis B and hepatitis C infections in Canada, especially in a population-specific manner from coast to coast to coast. Data collection methods would ideally work through the cascade of care in community clinics, mobile units, family doctors' offices, hospitals, specialist clinics, clinical laboratories, pharmacies, and treatment funding programs. And with this data, important analyses and modeling will showcase its real-time accuracy, unleash its predictive power. Accurate data can guide healthcare and public health leaders towards evidence-driven actions that are reactive and helpful, preventative and protective, all while striving for the ambitious viral hepatitis disease elimination targets set for 2030. The data collection and sharing plan will be successful with sustainable, long-term funding and will inform public health and healthcare for years to come, operating through epidemics, pandemics, crises, and all the time in between. Ongoing funding would permit the tracking of new infections through increased diagnostic efforts, as we spoke of, improved access to treatment, providing effective vaccination, and recognizing rising cure rates. A well-thought-out and supported data plan will allow us to truly appreciate and respond to the evolution of hepatitis B and hepatitis C infections in Canada. This viral hepatitis research, medical, and advocacy community remain hopeful and optimistic that the federal government will prioritize support to collect updated HBV and hepatitis C prevalence estimates and the population-specific cascades of care across every corner of Canada. This ask and all 5 federal asks are critical for Canada to reach towards the elimination of viral hepatitis as a public health threat by 2030. Thank you.
conclude the press conference. Thank you very much.
Thank you.